I'm almost as young as I can remember, probably around 3 to 5 years old. I've always wanted to be a veterinarian. So I remember first time I ever thought about it was at our horse farm, and our old vet, Doc Oakley, had come out, and he pulled some wolf teeth on one of our big draft horses and threw the bloody teeth right in my hand, and I said, man, this is the coolest thing ever, and this is what I want to do for the rest of my life. And pretty much since that moment, everything I've done throughout my life really has been focused around veterinary medicine and being around animals and the people that work with those animals. And it's really cool environment to be around, to be able to help those in the community, and you're doing that by working with the ones that they value and what brings them income. And it's way more than just kind of your regular run-of-the-mill job. It's something that you really enjoy doing every day. One of the things I've always thought about in veterinary medicine since a young age was being able to think outside the box. I've never wanted to get just filter-minded, and wanting to be able to think outside the box, try new remedies, try new solutions, and be able to actually make advantage of all the science that we do have coming our way. 100 years ago, we used to bale hay with horses. Why don't we do it like that anymore? Because there's better ways of doing it. So I think the same thing about veterinary medicine. We can do it the way we did it 100 years ago, and there still are really good things to learn about that. But at the same time, let's make use of these new methodologies that we have and be able to bring ways to either decrease time or increase solutions, anything like that, to get a better outcome with better pain control, better disease management, higher calf crops, higher full survival, just really being able to improve upon the medicine that we offer nowadays. So recently I just became certified in veterinary medical acupuncture. And doing this, we took a scientific approach and actually learning the science behind acupuncture and making it super valuable as an extra modality that can be used in veterinary medicine. Be it from a kitten that walks in the door, to a cow that's giving birth, to a horse that's performing in rodeos. And it's amazing how diverse acupuncture can be used just for, say, trigger points that we find in the muscle that might explain why a barrel horse is a little bit sore going around that first barrel, to maybe explaining why that one cow is always lagging behind the rest of the herd because she's a little stocked up, just can't get her hind end moving as well. So it's really being able to use the scientific component of acupuncture to just serve as another modality to be able to increase the way that we can help our animals. A few years ago, I was able to go to Africa and work with some elephants over there in an orphanage, and actually be able to do acupuncture on these elephants, do full neurological exam on these elephants, and be able to look at their behaviors as they're transitioning from orphans to being able to turn back out in a large herd population. And it's amazing, you would never think that you would learn so much from an elephant that you could transpose when you're working with cows or when you're working with dogs, because trust me, if you can outrun an elephant, you can definitely outrun a cow. It's amazing that opportunity, how much it was able to help me in working with large animals and small animals alike today. Another recent opportunity was traveling down south to the Bahamas and actually doing some veterinary work on dolphins. That really allows you to learn a different way of culturing those animals and being able to collect samples in order to come up with the best treatment protocols for different bacterial infections, different viral infections, and just management factors. So being able to look at a very different environment and come up with management methods that can improve the health of those animals in that environment, and also being able to find ways of testing a very diverse environment in order to be able to improve the health of those animals. So working with dolphins can also help with working with cattle or working with dogs. Another modality that we're making use of now is ultrasound. So ultrasound is a very dynamic tool that allows us to see so much more of what's going on with an animal. One of the ways of using this is with horses. So being able to ultrasound a colicking horse and looking at their bowel and how it's moving allows us to come with a more accurate diagnosis of what actually is going on with their GI tract. And additionally, we can use ultrasound to ultrasound tendons and ligaments on horses. So being able to see where we have tears and being able to get a better idea of the timeline involved with those healing and actually what we are trying to repair there. Another use of this ultrasound is being able to ultrasound cattle for pregnancy diagnosis. Not only does it allow for an increased speed with pregnancy diagnosis, but also allows us to have early detection of twins, early detection of aborting fetuses, early detection of mummified fetuses, or any other weird pathology that might be going on in a cow. Ultrasound is also very useful in small animals. So we can use ultrasound to ultrasound a liver in a small animal to see if we start seeing metastasis or moving of cancer to a liver, or to a kidney or any other internal organ. It can also help in searching for foreign bodies and other pathologies that we might be worried about in either the abdominal cavity or thoracic cavity of small animals. Healthcare maintenance in our small animals, like our dogs and cats, is definitely very important. So being able to bring them in for a regular physical, including looking at their eyes, looking in their ears, making sure that every other aspect of them that we sometimes forget to look at closely every day is doing well. As part of these physical exams, we like to include ophthalmology, so looking at their eyes, dermatology, looking at their skin, looking at their ears. We also like to do an orthopedic exam, so seeing if we have any stiffness in our joints, if we have any abnormalities in how our muscles feel or how they move. They can give us signs of early orthopedic diseases. Also can tell us if maybe we need to consider doing some acupuncture or massage to help our animals move more ideally. In addition to just these regular routine checkups, we can do routine blood work, so looking at their bodily organs and how they are functioning, looking at their electrolyte levels and looking at their blood. So their white or fighter blood cells and then also their red blood cells, seeing how those look. It's also good when you bring them in. We can also do vaccines and basic routine maintenance on our small animals. For our large animals, it's also important to do continued care, be it if we're just doing health certificates to get on the road and get to a show, or just doing a physical exam with some vaccinations to make sure we don't see any early signs of problems coming into play. Routine dental work in our horses is also very important. So we have power floats now which allow us to be able to more quickly get through an equine exam, dental exam, and also allows us to be able to do a more thorough exam and really do all the work that we need to do to those teeth. So when we do a dental exam, we're doing an entire oral exam. So looking at all of the bones, looking at their vasculature and the nervous system, making sure all of that is appropriate, and then looking inside their mouth and really seeing if there's any signs of early trauma, early offset of their teeth, any teeth that might need to be pulled or anything like that. So routine dental work is definitely very important. Also, if we're having any problems with the performance of our horses, it's important to get a good dental exam done on them and getting their teeth floated. So that way we can get those abnormalities back to normal and get our horses gaining weight and performing normally. It's definitely important too for our cattle to make sure we do routine fertility exams on them prior to putting them in with our cows, looking at their semen to make sure that their semen has good motility, so they're moving around well, they have good morphology, that their shapes are normal, and that they're also concentrating very well. So during these exams, we also can do a whole evaluation of the bull, so making sure that they're physically sound to go out with those cows, they're going to do their job. We're also going to make sure that everything, their internal reproductive organs and our external reproductive organs, don't have any abnormalities to them that might prevent them from performing the way that we want them to. At this time, it's also a good chance to be able to do any health certificates for moving these bulls, and then also doing any trick examinations to make sure that we're good for transporting them and for the health of the cows that they're going to be working with. My approach to veterinary medicine is not strictly me working with a dog or a cat or a cow. it's working as a team. So working with the owner, yourself, and trying to work with that owner and animal to form a team and really address the owner's concerns or your concerns and what the animal's telling us to form a whole picture in order to provide the most optimal care that we possibly can. So it's bringing in all of those facets of what the owner's seeing, what the animal's telling us, and how we can come up to the most perfect plan to address the owner's concerns and address the concerns that the animal is showing us as well.